cases as of August 15th were 16,878 cases. And then you can see by month at the bottom, March, April, May, we had less than 300 cases. And then in June, 2119 cases. And then in July, 9907. And then in August to the 15th, 4577 total cases of COVID-19 in Nueces County. So the highest cases were the 20 to 29-year-olds. These are the ones we call the super spreaders, 3,207 in that age group. But also if you look at, we lumped them up as school-age group. 12% of the total cases are in that group. But these also include 0 to 4, and they also include 19-year-olds. And so I'm going to show you specifically for the schools in a few slides. And then you see the others by age group. The largest age groups are from 20 to 59 years of age. And then the lesser age groups are 60 plus. So the deaths by months as of August 15th. So in March, we had no deaths, which is great, but we started to see cases. So you always hear about the lag. So you don't have any cases, any deaths in March, but you have cases in March. And now in April, you have 3 deaths. In May, we had cases. We had no deaths, but we had cases. And then in June, you see 5 deaths. And in July, we had 168 deaths. In August, we had 103 deaths. To the 15th, about 7 cases per day of people dying. Next slide. So I tell everybody I do have good news every once in a while. So if you're younger than 50 years of age, you know, the death rate is very low. About 26 deaths in that age range, but over the age 50 plus, 253 deaths as of August 15th. So 90% of the deaths are in 51 and over. So 51 years of age and older, 90% of the deaths. So those are the number of positives that we've had in our drive-through compared to the total number of tests that we've actually run through the drive-through. And that's about a 27% positivity 19 rate. Cases in Nueces counties by school-age children. So the number of school-age children is 1,247. That's from 5 years of age up to 18 years of age. Interesting is if you look at the bottom of the age group, the 16, 17, and 18-year-olds, these are the ones, again, that are more mobile. The numbers go up. So COVID-19 and school-age children, it's the same as what adults have. The incubation period is also the same as well, the 2 to 14 days. For the person, you're going to assess the risk, and then you're going to decide whether to close for a short duration, kind of like a hot shot. You're going to do something, it's on a small scale. It might just be that it was in the front office or in a back office, and so you can do something on a smaller scale. The decision really is a much bigger decision when it's in a classroom. What are we going to do? And see, it says basically on the CDC guidelines to coordinate with the health department, dismiss students and most staff for 2 to 5 days at least, communicate with the staff, the parents, and the students, clean and disinfect thoroughly, make decisions about extending the school dismissal. So after September 7th, you could say, you know, we're going to wait and we're not going to start school until this date. So, or if you started school and then you wanted to, you could actually say, we're going to extend the dismissal until October 1st or whatever date decision is made. Implement strategies to continue education, so go back to virtual learning and related community transmission. We have been in somewhere between moderate and substantial community transmission here locally. But the health district's phone banks are getting less and less calls. So what you see in June in phone calls, you probably see in July in cases. So people start calling, they start saying they're getting sick, something's wrong, they don't feel right, they came in contact with somebody, and then you see in July, you see the actual cases start to increase. It's a software that we saw early on in March that Harris County was using. And this software actually will assist us with when people come through the drive-through. So what will happen is they don't even have to call the phone bank. They can actually go directly to the website and they can actually sign on and they can put all their demographic information. So we'll have all this demographic information that currently we may not have as much of right now because we try to minimize, you know, all of that. What we get right now is we get their name, we get their date of birth, and we get a good cell number so we can call them back if they're positive. So they put in all their demographic information and then they can actually pick what day they want to be tested. So they're wanting to get tested tomorrow. They can pick it on the calendar. If it's full for tomorrow, because we know that we only have 500 VTM available for tomorrow, then it'll say that it's closed for tomorrow and they can pick the following day. So it's going to coordinate that, which is very helpful, as well as, take some of that burden off of the phone banks if you're just calling because you're wanting to get in through the drive-through. It also does a risk assessment, and so it'll tell you, like, yes, you do need to get COVID tested because you meet the criteria, or no, at this time you don't because you don't have any symptoms, and so you do not need to get tested through the health department drive-through. So you can use a QR code. So once you have and you've finished and you're set up for your drive-through, there's a QR code that you'll get on your phone. So you match up the phone that we have with your phone through the drive-through, and then all the information comes up, Annette Rodriguez, with all my demographic information. So it's quick, makes it, simplified for the drive-through process. The other part that we're very interested in is that we're now doing pulse oximeters through the drive-through. So not only do we do a nasal swab, we also check your pulse oximeter to see what your oxygen saturations are. And what we've found is that we have found some individuals that have low oxygen levels. And what we do is we wait to see if those low oxygen levels match up with a positive PCR. And we have found that over 90% of the time they actually do. And so, and we have found that over 90% of the time they actually do. And so at that point, you can actually give them a patch. Of course, we have to purchase the patch, but you can give them a patch. They put the patch on, so they stick it on their body. And for 14 days, it actually monitors their pulse ox, it monitors their pulse rate, and it monitors their temperature. So they're starting to get sicker, you can see those things. So part of what we try to integrate with, we have a new COVID-19 outpatient clinic, and so we're trying to coordinate that telemedicine, if you will, with the outpatient clinic. Many of the individuals that come through the drive-through do not have a PCP, and so now they have a PCP that'll do telemedicine with them, and we'll look at their how their monitoring is going with their patch, and then they can, give them the medications that they need based on those results. So it's a really exciting software for us, and we're just real excited to get something that we can integrate with the Texas Health Trade.